My case acceptance is 100%. Zero rejection. Financial problem is a genuine problem. The last thing that you can do when you are actually stealing is get caught. Your role as a clinician, as a health provider, is to provide them with all the options. I don't want it to sound like I'm just bragging about myself or I'm just telling something which is difficult to achieve. But I have, just to give you a bit of an idea, my case acceptance is 100%. Zero rejection. I never get rejection. Never, ever. And when I actually say that, people do get surprised. And I'm like, really? How can that happen? How can you never get rejection? And my simple answer to that is, because I am never telling them what to do. I'm never telling them what to do. I am giving them their options. Now, like as we started, and Sadi, you actually very well mentioned it to me, that not everyone, not everything is made for everyone around you, right? So, yes, there will be a group of patients who don't quite agree to what you are saying. Your planning does not match to what their expectations are, but your role as a clinician, as a health provider, is to provide them with all the options. And one of my options always to all my patients, and thankfully I'm in a modality, I'm not in a life-saving role, right? Okay, so I am in a modality where I can actually give my patients, one of the options is no treatment. And I tell them what will happen if you don't do the treatment. So if they have elected not to go ahead with the treatment, they have agreed to what I've said. And that is how I get 100% acceptance. No rejections, ever. Someone goes ahead with my $35,000 plan, 100% acceptance. Someone says, I don't want to do anything, no problems at all. My job is to give you all possible options. Okay? Communication, I think communication, when you are doing that, it is the problem starts to happen is when you start to drill down too much into the problem. That is where the biggest mistake happens. When you start to drill down into the problem rather than recognizing the cause of the problem. I will tell you, earlier I used to be as well, and over the time I have developed this thing in my head, like just the same way, like as I was saying earlier, that I try to train myself to think that I'm not busy. I am quite free. I have a lot of time. The same way, I have trained myself to think that whenever there is a difficult patient in the chair, that is the best patient for me. That is the type of patient that I want to see. That is what differentiates Sanjiv Pathak from any other general dentist. Is I think that is the patient who needs me. And I put my biggest training out to practice then. First of all, that's the most important thing, that you get into the mindset there are no difficult patients. If someone is actually behaving difficult, it is for a reason. And I will give you a very quick example. Last night at 6 o'clock in the evening, I was actually given a patient take out 2 wisdom teeth. Young girl, beautiful young girl. She's very cooperative, but very nervous. And I did not know that. She was all good. When we were doing the consent form and we were talking about it, she was all good. I gave her the anesthetic. 2 minutes later, she was absolutely howling. She was like, oh my God, I'm getting headache. I'm about to die, this and that. And she had the whole clinic up on her head. I was like, okay, Sanjiv, this is the patient. Now I've done surgery all day long. Easy patient, the last patient of the day. But I'm like, okay, here is Sanjiv when you really are put to test. I talk to the patient. I comfort the patient. I know, first of all, this is where knowledge works very well. I'm not panicking here. This is where I said knowledge is your biggest tool, because I understand this thing that by me giving her local anesthetic, she cannot get headache. There's no reason for me to panic. It has got nothing to, even if she's getting a headache, that has got something to do with her. It's got nothing to do with me. And now what I need to do is I need to calm her down. Now I know this for a fact that if a patient is breathing too quickly, like if they're not taking deep breaths, what they tend to do is they hyperventilate. And when they get hyperventilated, they get confused. And this is common. This is common practice where we say, okay, just put your hands around the nose and breathe your own breath. And that way you are getting some carbon dioxide into the system. And 5 minutes later, she had calmed down. What I'm trying to say is there are no difficult patients. There are no patients there is no one. I mean, I will only counter the thoughts when people say, oh, he didn't want to get a good treatment done by saying this. When was the last time someone was traveling economy and they were given an upgrade to first class and they said, no, I want to travel economy. I do not want to travel first class. No one ever does that. There has to be a reason behind that. Either you have not been able to relate to them, or you have actually not heard their concerns, or yes, they can be financially concerned. And which is a genuine concern in this day and age, like we are all, people are like, financial problem is a genuine problem. Don't judge the person and don't judge yourself by saying, oh, I must have done something wrong. People have genuine financial concerns because of which they don't get treatments done. So you don't need to take it on the chin. You give them their options, relate to them, express it to them, explain them the cause of the problems, explain them the consequences of not doing a treatment properly, what will that lead to, and let them know that you are on their side. If a patient comes to me and says, okay, I've got missing teeth, I have given them all the options, no treatment, denture, bridge, dental implants, they said, I want dental bridge. Almost always, my first reaction is, fantastic. You want dentures? That is a great choice. Because I was the one giving them the option, right? That will be the last thing that I can do is and tell them, oh, really? You want to do dentures? And they might turn around and say, but you just now gave me the option. The denture was actually an option. Now it is your job to let them know that, okay, you have opted for denture. These are the pros and the cons. And now it is your harvest. It is your choice what you want to do. If you are going for that option, you know its advantages, you know its disadvantages. And there you go. So I think communication is a great asset to have, and it will get you out of real deep soup in difficult situations. But please don't use communication as a tool. Please use it as a way of getting to know someone else better and getting to know what they are thinking and trying to help them in their journey. Don't use that don't use that to outsmart the patients, because believe me, everyone in this world at some stage of their life have done a management course. Everyone has done some sort of a management training, and if you start to use your management skills and communication tools to try to communicate, they sense that. And that is the worst thing. That is what they say, that the last thing that you can do when you are actually stealing is get caught. You cannot be caught selling even if you are selling. So be clever. Okay. Good.